The North Tower project at the Moses H. Cone Memorial Hospital reaches its halfway point with a topping out ceremony. I'm Doug Allred. We'll have that story, plus introduce you to some employees who really are super. Those stories in this month's Code View.
That we're providing this economic boost to our community by spending $200 million.
These are exciting times for Cone Health and for our community.
With a bit of fanfare, North Tower officially reached its halfway point. The final steel beam signed by hospital staff was placed inside the largest construction project in Cone Health history. A topping out ceremony for the six-story, $200 million structure was held May 11th. It was an exciting day, especially for staff.
Staff has been involved from the very beginning in helping design and plan this facility, and we're so excited to be able to bring a new place for them to deliver care for our patients with all private rooms, with efficiently designed space. We're real excited.
North Tower really will take health care to new heights for Cone Health. It will bring 96 private patient rooms, 16 large modern operating rooms, and a host of features designed to improve the safety and comfort of patients for decades to come. Cone Health wants to know what's on your mind. Plan now to take part in the annual employee survey. Every year, Cone Health asks about a variety of topics such as communications and resources to help employees do their jobs.
It's extremely important for us to hear opinions and input from employees because we want to be the best place to work in healthcare, and only with that input can we know what we're doing well and what we can improve on.
You can take the 2012 Cone Health Employee Opinion Survey from June 4th to June 25th. Your manager will provide an envelope with the information needed to anonymously take the survey. Congratulations, Sarah Clark, Janet Dawson, and Courtney Keats. The three were finalists in the 2012 Celebrating Nurses program run by the News and Record. The three were selected by judges from the North Carolina Nursing Association on attributes ranging from leadership to how well they exemplify nursing. They were honored at a banquet in May. Congratulations also to Unit 2000 at Moses Cone Hospital. The unit is the recipient of the first Golden Trash Can Award from Environmental Services. Environmental Services Brighten Your Day Committee created this award to recognize the unit that best helps them in their jobs. In this case, an Environmental Services worker had a daughter being cared for on the unit.
While Tammy was working and her daughter was a patient on the unit, the staff here assisted by, they went in her rooms, they pulled the linen off the beds for her, they pulled the trash in the rooms for her, and it made her job a whole lot easier. And Tammy's exact comments were, I felt more than just a housekeeper. I felt like I was a part of a team.
Superman became super because he was lucky enough to come to Earth. For these employees, adding super to their title takes a bit more work. These employees are training to become Cone HealthLink super users. This group will be the first to help when questions arise at Women's Hospital, Annie Penn Hospital, or Med Center High Point on July 7th. That's when those institutions go live on Cone HealthLink.
The purpose of that is so that when our departments go live, we'll be there out of the clinical setting to stand side by side with those end users and help them get through this process.
Super users go through 40 hours of training to prepare for a go-live. A few clicks on the computer can save a lot of time for social workers and others trying to arrange care for patients leaving the hospital. Cone Health now offers Total Living Choices. The website can make connecting patients with assisted living centers, for example, a much smoother process.
Where before, when we made referrals to long-term care, for example, we may wait for faxes or telephone calls to try to make arrangements for patients and their families. Now, all that's web-based, so we just simply create the profile, force it out to the centers, and then they can respond very quickly. So we've been able to receive offers for services within 10 minutes of our submission.
Patients and their families can use a similar version of Total Living Choices through the Cone Health website. This allows patients having surgery, for example, to arrange all the care they will need after the surgery before they even have it. Everyone knows Aaron Solutions as a quick, convenient way to get tickets, change watch batteries, or even book your next vacation. Now this benefit, which promises to make life a little more convenient, is more convenient for those who work at or near MedCenter High Point or MedCenter Kernersville.
Aaron Solutions actually is in hotels as well as hospitals, so we've got to see all spectrums of concierge service and want to extend every opportunity we can to the employees so that their focus can be the patients, not what they have to do after work.
The Aaron Solutions representative is at MedCenter High Point from 7 to noon Mondays and Thursdays, and from 12:30 to 5 Mondays and Thursdays at MedCenter Kernersville. Before we leave you this month, let's return to North Tower. Dr. Clint Young has seen North Tower like perhaps no one else. Young has been taking photos of the building project nearly every morning after he pulls into the nearby physician parking lot. Young has taken hundreds of photographs, even making his way onto hospital rooftops and into one of the tower cranes to get unique angles on the $200 million project.
I think the ones that I call myself fire in the sky, the bright orange, red sunrise pictures that I took at the very beginning are among my favorites.
Young doesn't really have a plan for what to do with this photographic record. He would like to give copies to Cone Health. That's it for this edition of Code View. I'm Doug Allred, and I'll see you next time.